Hi, my name is Dr. Rakesh Jalali. I am the director of the Apollo Proton Cancer Centre and I'm a neuro-oncologist and radiation oncologist. Today I'm going to talk to you about the present unprecedented challenge of COVID-19 and in particular how it is affecting our medical practice, particularly taking care of cancer patients since I work in a dedicated cancer center. First of all, there is no doubt the COVID-19 has presented such a tremendous challenge for the healthcare workers, for the scientists, for the patients, for the people in the society at large, that this was something which we could never ever believe that it would be of such an enormous, with such an enormity. Still, throughout the world, the cases are being reported, including in our country. Our government, in particular in India, took a very nice step, which was a little bit bold, but which was absolutely necessary, of a lockdown, and has created very scientifically different zones. And because of that, we can see, as compared to other countries in the world, the statistics are a little bit better than what is happening elsewhere. As some of you know, at the moment throughout the world globally, more than 3.2 million people have been diagnosed with COVID-19 virus, the coronavirus, in particular this type of unique strain, and more than 240 to 250,000 people have already succumbed to the virus. And a lot of has been already written about the virus, its ability to penetrate inside through the aerolization, through the route to the upper respiratory tract and eventually affecting the lungs, and with rapidly infiltrating into the tissues such that they have a relatively high incidence of morbidity and also mortality. The mortality, the people dying because of this infection, is close to about 7 to 8%. In India, relatively speaking, the cases are only about 40,000 odd, and if you look at the mortality rate is also much lower that is reported in the West, and that is because of number of reasons. But mind you, it is unlikely that this problem will be completely solved in the very near future, although we are all hoping. We are blessed to have such an inspirational leader of the Apollo group, our beloved chairman, Dr. Pratap C. Reddy, who beautifully and almost on a daily basis has been telling us, has been encouraging us, has been inspiring us to tell. Even in his candidly, he remarked that it has changed the way of our life. Therefore, we as a medical community and other people, healthcare workers, and also the people in the society, we perhaps have to look at it a little bit in a different manner, such that we make the necessary adjustments for a different life. As I mentioned, Dr. Reddy has been telling us, such that we make the necessary modifications and alter the plans so as to give as best possible care to our patients and to the families as much as possible. As far as cancer is concerned, and I have been talking about it for a while now, for the last few days and few weeks, that and justifiably so, the focus has been to find a cure and to control the disease affected by the virus directly. But we simply cannot afford to lose the focus of taking care of other medical illnesses, and in particular the non-communicable diseases, which already is actually in the form of an epidemic. For cancer, although I gave you the statistics of coronavirus and COVID, worldwide 17 to 18 million people will be affected with cancer every year, and about 9 to 9.5 million will actually die of cancer, either because of these or of the old cases. In India, about 1.6 to 1.7 million people get cancer every year, and we lose out about 7 to 8 lakh patients also because of the disease. And at any point of time, we have about 25 to 30 to 35 lakh people living with the disease. So there are several aspects with which the present scenario is affecting the cancer care in general. Number one, there is a delay in diagnosis. There is a fear and anxiety among the cancer patients not to approach the medical facilities. And also, even if they want to approach, the medical facilities are not completely geared up to look after these patients because of the fear and because of the barriers we have. We have the physical barrier of relative lockdown and the transport and the communication, but also there is a fear from the healthcare facilities and the patients and caregivers not to approach them. And with that, there is a profound fear among oncologists and among healthcare planners that there might be a massive epidemic after this cancer, after this corona pandemic. So therefore, there is a delay in diagnosis. That is a major issue. The second thing is those people who ever are getting diagnosed also or are already under treatment, they are not getting appropriate care. As all of us know, cancer treatment is a multidisciplinary treatment. Not one person can treat or cure cancer. There is a team of people who look after these patients. So there is usually a surgeon or a surgical oncologist, there is a radiation oncologist, there is a medical oncologist who looks after the systemic therapies. There are diagnoses which we have to make because of the imaging, because of the pathology, because of the molecular diagnostics. There has to be a pain management, there has to be a palliative care. It is a tumor board discussion which is evidence based. So therefore, the modern cancer care is given by team of people looking at that particular aspect of or that particular cancer. And also, cancer is not an easy disease to treat. The margin of success of curing a cancer patient or not curing a cancer patient is relatively small. And because of this current situation, there is a fear, and we are sometimes witnessing it already in different parts of the country and different parts of the world, that if you do not take appropriate care and you do not take appropriate precautions and you do not give confidence to your healthcare facilities, to your healthcare workers, and importantly to the patients and their caregivers, this narrow margin of success and failure will be lost. And we should not lose this otherwise a curable patient of a cancer patient. We should not lose them too many because of the current situation. And thirdly, also is the follow-up of the patients, how the patient is doing, what we should do, and so on and so forth. So these are the three principal challenges that we are facing in general about the cancer and the impact of the current COVID-19 which is impacting oncology. However, there are some rays of light. It is not all gloom and doom. Fortunately, the oncology community, the healthcare administration, and many hospitals, may not be 100%, but many hospitals are coming together. They have been coming together in the last few weeks. There is a great synergy between the oncology teams, between different treatment facilities, literally throughout the world, because the problem has not left any society, has not left any geographical region. There might be differences in the incidence and magnitude of the corona problem, but it has hardly affected has not spared any geographical location. So therefore, there is a great deal of togetherness to overcome and formulate those SOPs and policies. And because of the media, because of people like you, because of digital platforms, the information is shared quite nicely between the different groups. Although sometimes too much information can also be a problem, but very carefully with the appropriate scientific rigor, a number of policies throughout the world, including in India, have been formulated to look after the cancer patient. So my plea and request, therefore, to the oncology community, to the healthcare administrator, to the hospitals, and most importantly to the patients and their caregivers, is to be little bit positive about the scenario, to please think and reflect about it and take advantage of the systems that we have put in process already such that we take care of you.